It's never really been stylish or in vogue to be from rural America. There are very few stories or poems written by those not born into the foothills, mountainsides, or plains, wishing to somehow become one of us. In fact, most people lead us to believe that there have always been and always will be droves of people who are just desperate to leave. Almost always from the outside looking in, rural American issues are picked apart and analyzed by pundits and policymakers, with opinions laden with pity for those who call the small towns and rural byways their home. The world tends to take us for simple, for ignorant, for people who've been dealt a bad hand from which they need to escape. Funny though, how we see rural culture becoming popular culture in social media reels and television dramatizations. All of a sudden, they like how we dance, the clothes we wear, the way we talk, the music we make, and our slower way of living. Strange how for so many decades we were the poor and backward souls who needed saving. Now all those same people desire nothing more than a slice of our countryside so that they might escape the hustle and the bustle of urban life. How often in all of this do we get the chance to tell our story our way? The one written by farmers and coal miners and rail workers and Depression-era lifestyles. The one where we're the experts, ask for our thoughts and priorities, rather than having them projected onto us by those in ivory towers in faraway lands. The answer is almost never, until now. Cut a Trail is a program dedicated to recognizing, discussing, and amplifying rural communities across the country. Why? Because hill people don't stop walking when the path comes to an end. Instead, they cut a trail and move forward with grit and determination. We're quite used to making a way, even when the chips are stacked against us. Join me, your grateful host, on this journey to share the best examples of rural community building that we can find, elevating the voices of change makers, trailblazers, and good neighbors throughout the hollers and hills of rural America, all making positive impacts on the people and places around them, all cutting a trail where there once was nothing. My name is Colton Wolf, and I'm proud to be a native Appalachian who was born, raised, and still resides in the Shenandoah Valley of Virginia. I know better than anyone what a blessing it is to be from the sticks and how much of a real advantage it can give us in a world full of convenience and immediate gratification. I hope you'll join me in my effort to connect rural communities and showcase all the good things within our home places that deserve but never get the limelight. Welcome to the Cut a Trail podcast.
Welcome to episode 3 of the Cut a Trail podcast. I am your grateful host, Colton Wolf, and today I'm so excited to talk to Dr. David Switzer and Ben Dowleski. As we learn more about the Page Free Clinic and all the amazing work that they're doing for the uninsured populations in our community. As healthcare remains a central topic in our national conversation, I'm excited to take a deeper look at the healthcare reality of rural Americans and the vital role that the Page Free Clinic plays in the health of our community. I just wanted to give you, before we get down into the details of the free clinic, just an overview of what this program is about, why we do this, and what our goal is. So I stumbled upon an essay by Ralph Waldo Emerson many years ago, and I go back to it a lot. But one of my favorite pieces of that is a quote that says, "Do not go where the path may lead. Go instead where there is no path and leave a trail." So what we're doing is we're looking for the best examples of rural community where folks are blazing a trail, because I think often in rural America and in rural communities, we're kind of left to our own devices. And so people who are blazing a trail where there is no path to solve a problem or lift up a community. And I think that the free clinic is a perfect example of that. I wanted to get started and just see if we can learn a little bit more about you guys, about the history of the free clinic. It's been operational for 15 years.
Yeah, 15,
Right.
almost 16 now.
Yeah. So tell me a little bit about the history of the free clinic, the mission, all the good things.
So to give you the history, I do have to give a ton of credit to a gentleman named Dr. Arsha Masha, who is a family physician in this community. He came in 2008 with his wife, Dr. Danielle DeRocher, and they worked locally as family doctors until early 2016 in our community. And Dr. Masha had the vision of having a free clinic for Page County. We had not had a free clinic here prior to his coming. And so in 2010, he opened the Page Free Clinic and did all of the foundational work that led to where we are today. So he was the medical director and primary provider for the free clinic for several years. And then in 2015, he and his wife made the decision to move back to the West Coast to be closer to their family. That was where they were from. And so he prepared in 2015 for a transition to take place, revitalized the board of the free clinic so that it would be left in sort of a handoff governance position when he left in 2016. So 2016 is when I became directly involved with the free clinic. And so I have been the president of the board of the free clinic since February of 2016 as Dr. Masha was transitioning out.
Wonderful, wonderful. And then how about you, man?
Yeah, absolutely. So yeah, absolutely need to give credit where credit is due. We wouldn't certainly be here without Dr. Mashaw. I came on board in 2017, so almost 9 years, June of 2017, and certainly has been a passion of mine to help our community. I've lived here now almost 13 years, so really excited to see us grow. This is our second location. To give you a little background and our viewers a little background about the services we offer. Um, we're essentially a walk-in primary care clinic. So we're open Tuesdays from 4 p.m. to 7 p.m. No appointment is needed. Walk in. We serve uninsured residents of Page County. So folks that do not have health insurance. If you have questions about health insurance, we can certainly answer those questions. So to be a qualified patient of Page Free Clinic, you need to be ages 19 to 64. And the reasons we chose that is under 19, you could qualify for Medicaid very easily. And we can help with that. And over 64 qualify for Medicare very easily. So really being an uninsured Page County resident between those ages on a walk-in basis, we're one of the only few free clinics actually in the nation that do not charge a dime to our patients. So all of our services are completely free, which goes along with our mission of providing quality medical services to those who can't afford it. So you can come in, we can order tests like an x-ray, labs, and that will all be 100% covered. A lot of free clinics will ask for a donation. So we've been fortunate to have donors in the community and businesses in the community to help us be financially stable to continue with that mission.
How long have you been here?
2021, June of 2021, so it'll be 5 years soon, and certainly this is a convenient location. We partner with Valley Health, although we're our own separate entity. We do have a nice agreement with Valley Health to help our patients out. So if we need labs, x-rays, it's a convenient location, is being right down the hill from us.
So I would love to talk a little bit more about the population here that you serve. What does the need in Page County look like? Do we have, you know, more than some other communities might have as far as our share of uninsured adults? What is the need in our community that you guys see?
So maybe I'll start off by talking about a little bit of the demographics and the health related things, and maybe turn it over to Ben for some of the more financial statistic type data, so to speak. So I practiced primary care in Page County for 27 years. So I feel like I got to know the Page County population pretty well, what their needs were, what their barriers are, what their characteristics are from a health standpoint. And I will say that we do have a lot of folks who have a low level of health literacy, who have a lot of difficulty, understandably so, navigating the complicated healthcare system that we have in the United States today. And I can tell you from personal experience, in 27 years, it's only gotten more complicated. And so, in addition to that, there is a lot more chronic illness in the population of Page County as a rural population than you might find, say, in Northern Virginia, for example. Some of that has to do with access
Mhm.
to services. Some of that has to do with the characteristics of the population itself. But generally speaking, we have a higher rate of smoking. We have a higher rate of preventable cancer due to decisions not to get screened, whether that's for financial reasons or otherwise. Sometimes it's cultural reasons. And so we have a lot more, statistically speaking, percentage wise, obesity and the chronic illnesses that come along with that, type 2 diabetes, for example, heart disease, etc. So, in comparison to the average, if you will, across the state of Virginia, this tends to be a more chronically ill and less health literate population, which sets them up for some morbidity for obvious reasons. So, one of the things that Dr. Masha envisioned, and hopefully we have successfully picked up the baton on this, is trying to make sure that for those who have starting out with financial barriers, that we have a door to in which they can walk where they will receive evidence-based care and recommendations for their health.
The key word you said, preventative. So what we see a lot of times is patients come to us maybe a little too late. So we offer dental care for free. So oftentimes this may be the first dental visit the patients have ever had, and we're seeing 12 teeth having to be pulled and then dentures being put in. So the key thing there is breaking down the access barriers to make sure people are getting care in a timely manner. So one of the needs to highlight on is for you, the folks viewing, is to spread the word, because it's essentially probably about 1 in 6 adults in Page County are uninsured. Pretty high. It's higher than the rest of Virginia. So we serve on average somewhere between 200 to 300 Page County residents per year.
Wow.
So it's probably a couple thousand that are eligible for services that aren't getting services. So really, I think the need is to get the word out. We're here. It's free. We have very qualified healthcare professionals. So getting treatment early is key. There's a lot of things we can do early on to prevent things from getting worse. We have essentially all of our volunteers and staff are from the county, so they know our resources available to us, how to help patients out. So really, just getting the word out. We're here. If we can't provide the service to you, we'll find whoever can, just to make sure we're helping improve the health of our community.
There's something, Dr. Switzer, that you said that I want to talk a little bit more about. You talked about health literacy and how we have maybe more of our fair share of folks who um, struggle in that capacity. But you also mentioned that sometimes it's cultural. And so when you say that it's cultural, can you talk a little bit more about that?
So maybe one of the specific examples that I can give you that I recall very vividly from when I was practicing locally here all those years is when it comes to cancer screening. And I'll actually maybe use the specific example of colon cancer screening just because I ran into this quite a bit. Um, there is a cultural view here that if it ain't broke, I'm not going to fix it.
Yes.
I'm not having any problems.
I'm
Therefore,
feeling well.
therefore, I don't need anything. And trying to communicate through that cultural view, which can sometimes be very challenging, is that the value of a screening test is that you identify disease in two key things. Number one, before it's clinically apparent. So you're identifying it before the patient knows something is wrong. But secondly, and probably even more importantly, you're identifying it when you can change the course of that illness. And so, colon cancer screening specifically, the vast majority of colon cancers in our country are preventable if you screen. And so, trying to educate the local patients in a way that they can understand that meets them where they are, that is in language that is familiar to them is extremely important. And I picked that out as the one example because that certainly was a recurring theme for me specifically over and over.
So I find that incredibly interesting because I was born and raised here, as you know. So I I honestly have to fight some of that in myself sometimes. I am not quick to go see my physician if I have a cold or if I have congestion or anything like that. And I know we don't always have to run to the doctor, but at the same time, there are a lot of scenarios in which I can recall that I should have been more proactive. And I thought to myself, well, I'll just tough it out. It'll be fine. And honestly, in the last 2 years, I've faced some significant health problems that kind of reset the way that I think about those things. But, my family, also born and raised here, I see the same thing. My father, um, you know, multiple times has had to be hospitalized because of an unwillingness to seek help when he probably knows that he needs it, but hasn't gotten there. And so we're working on that too. So I just identify a lot with that cultural factor. And I think that the key part that you said there in pulling those people in and trying to help them get into identifying these preventable diseases, intervening, things like that, is meeting them where they are and speaking to them and communicating with them in a way that is respectful and takes all of those things into consideration. I think your staff being from Page County and local to Page County is really helpful because you said they know the resources, but they also know the nuances of the community. You know, and I want to get to the way that you guys handle the patients here in a little bit, but I'm really glad that you brought that up because I think in rural communities everywhere, that is something that is hurting us a lot. Like you said, preventable cancer, the rates of smoking are much higher, obesity, and things like that. So the question becomes, as you said earlier, is it an access issue or is it a health literacy issue or a cultural issue? Sometimes it's a blend of all three. And I think that the free clinic does a lot to tackle some of those things for the uninsured population. Well, I know they do in Page County. So I want to learn more about what it's like if I'm an uninsured adult and I find out about the free clinic and I decide, okay, I'm going to make the call. I'm going to see if I can get an appointment. Can you just tell me kind of what the steps of that process look like? I know that you guys take deep care to have things be judgment free and have things be respectful, and I would love to hear about those aspects too.
Probably let you take the ball on that
Yeah,
one.
absolutely. So yeah, so a few ways of looking at this. So for the folks listening, you hear about the free clinic. A few ways to reach out to us. First, as I said earlier, we're walking, so you don't have to make an appointment. Just walking between those hours, 4 to 7 on Tuesdays. But certainly feel free to call us, 540-743-1054, or email us, pagefreeclinic@gmail.com. So as I said earlier, we'll provide services to Page County residents that have no insurance that are between the ages of 19 to 64. We do have a financial eligibility, and that's 0 to 300 of the federal poverty limit. So just to make that easier to understand, breaking that into dollars. So a single person, roughly for the 2026 tax brackets, 300% about 40 grand per year. So if you're an individual earning up to 40 grand or less, you qualify for our services. For a family of four, it's about $90,000. So we have a pretty wide spectrum. We want to be able to provide access to as many people as realistically as possible. So you meet those credentials. There's a few things we require to be seen, and certainly we're not going to turn anyone away. We're going to see you, point you in the right place, or ask for the appropriate documentation next time. But to make it easy, some sort of proof of residency. So whether that be a driver's license or an ID, understanding not everyone has that, then a piece of mail just showing your address, Luray, Stanley. The second is some sort of proof of financial income. That could be a tax return document, a payroll slip, or understanding some folks are paid cash. It's just a note from your provider saying Ben earns $250 per week, whatever that is. So really just the financial and the residency piece is really what we're looking for. And that's just for grant purpose, things like that. We have to have our policies in place. So those are things to come in. But once you come in, we have our friendly staff to do our intake form to review all that with you. We've got a nice, comfortable waiting room. We have about 4 providers that are on staff, 2 that are here on a regular basis, very qualified that have been in the community a while. So Dr. Cheryl Blanche, one of our great nurse practitioners, has been in the community, yeah, for
Everybody does.
for a long time. So her name may sound familiar. So we get the paperwork out of the way. You're going to have our team of nurses that will take your vital signs and then introduce you to the provider. So that's at a high level really what to expect when you come to the free clinic.
One thing that I wanted to ask you about is language services. So I noticed that you guys leverage a translator or an interpreter here, Lupe, right? And so that is awesome, because there are populations in this valley that English is a second language. Um, so that's awesome, and I don't think you see that a lot in other organizations in the community. I know that Valley Health and those other larger health networks have access to, say, teleconference translator, which I know because my fiance is a nurse and she's worked in some of those settings before, in clinics that primarily serve those with Medicare and Medicaid, things like that. And translation services was a big barrier for those patients. Even though you have those language services on the telephone, it doesn't always quite work out. There could be connection issues. There could also be, just normal, technology issues, et cetera, et cetera. But having someone here to help those non-English populations is awesome.
Yeah, and it's key going back to the health literacy, the care. Lupe is our great interpreter. It's been here almost since we opened, so she knows the patients, which makes it easier as our providers and our nurses are talking to the patient for her to really understand the healthcare and how we operate, to interpret it in an easy to understand way to help those patients get the care they need. But certainly our big thing is trying to break down access, whether that be language services, transportation, financial. We want to make sure we're helping our community as best we can.
Yeah, and the transportation piece, you guys will coordinate transportation if necessary, right?
Yeah, so if transportation is a barrier, we do have the option. That is by an appointment basis, is either arranging a transportation or even potentially, depending on your circumstances, a home visit.
Oh, wow.
So, again, just really wanting to make it easy for folks. But if those are services you need, definitely give us a call because we'll have to set an appointment up for
I think that it's critical because in rural communities like Page County, we don't really have a bustling public transit system. We don't have one, period. And we have had some success with a few Uber drivers, Lyft drivers, what have you, but understanding that the demand can only be so high in general, it's kind of hard for those people to stay consistently available. So providing, transportation services where someone, maybe up on Tanner's Ridge or what have you, an elderly, person or someone who's otherwise unable to travel, can get care either in their home, or transportation here is very considerate and necessary. So kudos to you guys for that. What does a day in the life for your respective roles look like?
We do this work because we're passionate about it. We both have other jobs that pay our bills and all of that stuff. We do this because it's a one of those intangible fulfillments that we get. So in terms of my role on the board, you said it exactly right. So the board is about strategy and vision. Where is the free clinic and where do we want it to be? And I will say one of the greatest things that has happened to us as a board is what happened in 2017 when we successfully recruited Ben to do his job. Because essentially what we do is meet as a board to discuss what our priorities and objectives are. And we can get into this in a little bit, but just to throw this out, like a few years back when doing a RAM clinic, a remote area medical clinic in Page, became one of the board priorities. Right. We went to Ben and said, how do we make this happen? We need your guidance. We need your execution. And so, to your point, we ask that the board members have that big picture view. Ideally, and this is the current state of our board. Our board members have always been immersed in Page County. And, they've lived and worked in Page County. They know the local culture. It's incredibly important to have a strategy that's going to work. The old cliche, culture eats strategy for breakfast, right?
Yes.
So we have to know the culture to have the right strategy. So that is, I don't know if I would call it day to day, but that is the role of the board and my position on it.
Awesome.
Yeah. Yeah, so to tag off of that, the board is technically my boss.
Yeah.
I'm the executive director of the Page Free Clinic. So, right, so it's the strategy and then implementing that to the day to day. So, the overall strategy is to achieve our mission, which is to provide healthcare every week to the residents of Page County. So ensuring we have staff in here, the nurses, the providers, the clerical staff for intake. But then secondly, what the free clinic needs. We talked about exposure, the projects we're working on, the RAM clinic, which we can talk more about, and then certainly fundraising. Since we are a nonprofit, we do accept tax deductible gifts, which is really what helps keep the lights on. About 60% of our budget comes from local donors and businesses. So we've been really grateful to be part of this generous community.
Yeah.
So then, strategically using those uh, funding and finances to help purchase, as you can see, some of our wonderful equipment around here.
Yes.
So, even though we're a free clinic, we do have state-of-the-art equipment and up-to-date equipment with health records and everything else to get a quality experience here.
Yeah. So you're kind of managing those tools and like maybe procuring some of those tools like you talked about. I mean, yeah, the equipment in here, and that's why I said earlier, looks just like a doctor's office. And I know that sounds kind of on the surface stupid, but honestly, it matters. That presentation and the way that people internalize this experience matters. And I think you guys do a wonderful, wonderful job of that. And I would just like to say that I was here last Tuesday, doing some B-roll filming for this episode, and I got the chance to spend about 2 hours with the staff. They are so much fun, first of all, and they are just incredibly kind and welcoming. Every patient that came in the door, they gave the same positive energy to, and it just feels like community when you're here. And I don't see how the patients can't feel that as well, right? So I just wanted to say that, talking about the staff, I really, really enjoyed that.
And I would add, and Ben can obviously flesh this out even more. The other incredible thing about our staff is the vast majority, if not all of them, have been here since day one. This has been a 15-year commitment for them and still going, which is remarkable.
And so, and all of the staff are volunteer. Is that correct?
80% of our staff are volunteers. So they come here on their free time, out of the kindness of their own heart to give back to the community. Absolutely.
That's still 80% is a huge amount to have fully volunteer. And I don't think that people all the time realize what a feat that is to keep those volunteers engaged. Obviously, the free clinic does a good job, because if we've had folks for 15 years that have been here from the start, that is amazing. And a lot of those folks were nurses for me when I was a kid. Now, you talked about funding and how your funding comes together. So 60%, you said it roughly, of your funding comes from local donors, businesses, and sponsors. So now, what about our other 40%? What does that look like?
Sure, good question. So we do belong to the Virginia Association of Free and Charitable Clinics, which is a great organization that helps network free clinics, advocacy at the federal and state level, and they have options for funding, grants. So they are very helpful and certainly helps keep our lights on, helps us meet our mission. So some of that will come from funding from them, so state funding from the governor's office down through them to the free clinics. They can also help us with grants. So I know earlier we talked about our requirements to be a patient. So for some of those grants, that's where we have those requirements.
Gotcha.
And then finally, I have to give credit to Valley Health. They do help us out financially. They help with this building, and also what's called in-kind support, that they let us send patients to use lab and basic imaging services for free.
Wow.
So it's really a great partnership.
Yeah, that's wonderful because I know, even as an insured adult, testing can be expensive, especially specialty testing. And I know that that's separate from just your basic imaging services. But even offering the opportunity for some of those folks to get that screening with imaging, or to get that lab work to see where they're at, and sometimes it's hard to tell when they've had lab work the last time, just to check things out, and for them or the clinic to not have a financial obligation for that, that's wonderful. And if there are any other partners that you want to call out or share, I'd love to hear about them as well, if there are other major folks that you want to give a shout out to.
Yeah, absolutely. So certainly Luray Caverns is a big name in our community, and they have been a generous donor over our 15 years. So I'd like to give a shout out to them. LD&B Insurance has been a corporate donor. Luray Import Services has been a regular donor. Turner's Body Shop. So a lot of local businesses and individuals that are helping us out on a regular basis. So I'd like to give a shout out to them.
That's great. And then, for the grassroots donors as well, those folks who are given maybe, a monthly donation of a smaller amount. While you have all these corporate sponsors, those things matter too. And it's great that you have some of those folks, private members of the community also, often quietly supporting, these initiatives.
That is absolutely true, and I guess, and Ben, please chime in. I think all of what you just pointed out and everything Ben just said is 100% correct. I like to think of us when it comes to this situation as extremely fortunate uh, and fragile,
Yes.
because the Virginia Association of Free and Charitable Clinics is very important. Valley Health is very important. The corporate donors that Ben mentioned are very important. All of the private donors that send us donations monthly, quarterly, yearly, the ones who support the RAM clinic each year. If we lost any of those segments of our financial support, we would be in a very difficult position.
Yes.
So we appreciate everything that has just been spoken to.
Absolutely. Yeah. Thank you for echoing that. And for the folks listening, if you're thinking about donating, two things: want to tell you how to donate, and two, how your money will be spent. So make it easy. You can write a check, P.O. Box 45, Luray, 22835, or online. We use PayPal on our website, pagefreeclinic.org. This is all tax deductible, so you'll get a letter saying that you donated a certain amount. But as Dr. Switzer was saying earlier, we do have a population that has chronic diseases, that are sick. So treating one individual patient, even though we have free on the door, healthcare is expensive.
Yes.
So it can range from $100 to $500 per patient. So thinking about your donor, if you donate $100, that will likely cover their visit to help us, provide a clinic, provide some of the payroll, provide prescription assistance. So think about every $100 will cover the care for the continuity of one patient.
Yes.
So again, I said earlier, our care here is free, labs are free. We also help with prescription assistance too.
Okay.
So this way it covers that entire visit.
Which is a big, big thing, the prescriptions. And I key in on that because I just had a conversation with my grandmother the other day, who I'm very close to. And she has diabetes. She does have Medicare because she's over the age. But she said these prescriptions, they're even more than they were, and I don't know what I'm going to do. And she's not the only person that I've heard that from. So prescriptions, I think, are a huge part of that, in addition to the care. And the fact that all of those funds are being used right here in the community, I think is critically important for potential donors and the current donors to know. I think we've seen a trend in folks who maybe are starting to want to donate more locally versus sending $25 to the American Heart Association or what have you. Studies have shown that folks are kind of wanting to be more localized and focus on their community. So, and knowing that all of those dollars are going right here to these populations um, is important. Also, on the other flip side of this, wanting to spread the word so that folks, uninsured populations here, know that they have the access to the healthcare that they need.
Yeah, I'm glad you made that comment because in addition to getting support from those who are in a position to do that, our mission is to care for the people who need the care.
Yes.
And if there are people in our community who need the care and aren't aware, that impacts our mission in a negative way. We want to get over that barrier.
Yes. This next question may be an opportunity to talk a little bit more about RAM. If you have like a major fundraising event, I know we're kind of in the midst of seeing how we can modernize some of those approaches and be a little bit more dynamic. But anything you want to share on that side, like flagship things?
Yeah, so I mean, the easy one to start with, I think, is RAM, because
RAM.
that has become a flagship of sorts. So to give you a little bit of background, RAM stands for Remote Area Medical. Remote Area Medical is a national organization, and their mission, which is in alignment with the mission of most free clinics, actually, their mission is to facilitate the provision of healthcare to Americans who have difficulty accessing it.
Right.
A lot of those folks are rural Americans. They do some inner city work as well.
Okay.
And I'm summarizing this hopefully relatively correctly, what RAM has positioned itself to do is to provide capital equipment and a core group of non-clinical staff members to facilitate medical, dental, and vision care. And typically the way that that is delivered is over the course of a weekend, a 2 to 3 day period, and they pop up a RAM clinic in a location that is designated as one in need.
Okay.
So to give you a little bit of history of how we became interested in this, I was actually not even aware of the RAM organization until about 5 or 6 years ago.
Okay.
So RAM, there has been a RAM clinic that has been present in Rockingham County every other year, typically at the fairgrounds, going back, I guess, into the late 2000 teens, something like that. Well, in 2021, I knew someone. Full disclosure, happened to be my wife. I knew someone who was volunteering at the Rockingham RAM Clinic, and she was telling me about it. I was like, "Wow, that sounds really awesome and amazing."
Yeah.
And so I went to Ben and said, "Hey Ben, how would you like to take a field trip to the Rockingham RAM Clinic to see what's
going on?"
So that was in May of 2021, if I recall correctly.
Right.
So Ben and I went to the RAM Clinic in Rockingham, and were just stunned at the operation, how robust it was, how well organized it was, and both of us came away saying, "We got to do that in Page." And so we took that on as a free clinic, kind of on our shoulders, solo, for the first go round.
Yeah.
And so our first RAM clinic in Page was in 2022. We held that at Luray High School. And so, and once again, just to summarize the services again, so the medical services are essentially defined by who volunteers. So if you get a dermatologist to volunteer, you can do a dermatology clinic all weekend. The vast majority of volunteers are general medical providers, family doctors, kind of like myself, some pediatricians occasionally, and women's health care providers often volunteer. We've had chiropractors, we've had physical therapists. So really, you're only constrained by who volunteers from the medical standpoint. And then the other two service lines, and quite honestly, in our area, the ones that are in the highest demand over and above the medical are dental and vision.
Yes.
So dental care is provided by volunteer dentists and hygienists. And we've had the good fortune of even having some dental schools come to our local RAM clinic from outside the state of Virginia to help provide care. And then on the vision side, we typically have optometrists and ophthalmologists, opticians, and there is the ability to provide glasses actually made on site and given to the patient before they leave
Really?
in the vision clinic.
Did not know that.
So for folks who need vision correction,
Yeah.
it's a tremendous service for folks in this area.
Yeah.
So even though it only happens one weekend a year, typically starts at around 6 a.m. on a Saturday, wraps up at about 2 p.m. on Sunday. We do typically 6 a.m. to roughly 6 p.m. on Saturday, 6 a.m. to around 2 p.m. on Sunday.
Yeah.
We have served at each of those clinics over the last 4 years, hundreds of people. And so we decided as a free clinic that was something that was very important for us to carry through yearly because of the need of this population. I mentioned that the first year we shouldered the financial responsibility ourselves.
Yep.
The next 3 years, we did have some additional support in collaboration with Valley Health, subsidized by a federal grant.
Okay.
That has unfortunately gone away
Yep.
for this upcoming RAM clinic. So in terms of things that we need financial assistance with for this year, we are back again to most likely supporting the RAM clinic financially ourselves as a single entity and figuring out how to do that.
Yeah.
But the RAM clinic is something, this will be our 5th one if you're doing the math, 2022, 2026. So this is RAM 5.0. We like to call it Rampage. I forget.
Yeah,
I
Rampage,
love that.
Yeah.
That's such
I forget,
a good
I
idea.
forget who came up with that.
It's a good pun.
Yeah.
Yeah.
So Rampage 5.0 is this year, and we are extremely proud of the services that we have provided through RAM. And Ben probably knows these figures better off the top of his head, but I do want to bring this up because to your earlier point, people who are donating their hard-earned money and they only have a certain latitude
Yes.
to provide charitable donations, and I understand that they choose very carefully, as they should.
Right.
What I want to say about RAM specifically is that a donation to support RAM, the cost of RAM is usually around $40,000 or so. However, the return on the investment, how much medical, dental, and vision care did we deliver with RAM last time around?
Yeah, so in September, we saw 315 patients. It was around $280,000 provided in free care.
Wow.
So if you're thinking about your donation in terms of return on investment, I feel like RAM is a very solid choice. If that's the direction you want to go as a financial donor.
Wow. And I think that in my conversations with some other folks, I think that there was a year for year increase in your participation from at least as patient load goes, right? What were we looking at there? Like 30 or 40% increase?
So it's been around a solid 25% increase.
25%.
Yeah. So to put that in perspective, the first year we saw about 215 patients, and we saw 315 patients this past year.
Okay. Gotcha.
And going back to some of the cultural discussion, and I feel like the reason that we have, as a board, and with Ben's input, have felt like RAM is such a priority to do yearly, is that culturally, word of mouth is so important.
Yes, it is.
and one of the things that we struggled with the first RAM specifically was this belief of that's too good to be true.
Yes.
There's got to be a catch.
Yes.
And the reality with RAM is, even though the free clinic's mission is to serve uninsured individuals, RAM's a little bit different because we know that there's a large population out there that is underinsured,
yes,
that is financially struggling, even though they have insurance. The only requirement from RAM is you show up and are willing to stand in line. You don't have to show any proof of insurance or lack thereof. If you are willing to wait for your service, you will get the service.
Wow. I think it's also important to remember that while folks may have health insurance, that doesn't always mean that they have dental insurance. It doesn't always mean that they have vision insurance, et cetera, et cetera. And while folks in their mind, dental and vision services may play like second fiddle to like primary health. I mean, that's life changing. People, a lot of times, I think, discount the relationship between your dental health and your bodily health, and how um, bad for your body it can be when things get bad um, with your dental health, and then how life changing it can be to be able to see.
Mm-hmm.
And how many of those folks maybe didn't even know that they had vision problems, and were suffering with migraines. I know these are things that I've experienced myself, suffering with migraines or what have you, as a result of some of those things. And so alleviating that at no cost um, is awesome. Awesome.
Absolutely.
So Rampage 5.0, when are we
Rampage.
looking at that? When that's
Yeah.
going to be what time frame?
So I guess to tag on to that, there's three groups I like to break it down. One are the patients that are interested.
Mm-hmm.
Two are folks that are wanting to volunteer. Maybe three are the folks that are willing to donate. So
Okay.
to give you all those specifics. Last weekend in September of 2026. So September 2026. I forget the exact dates. Forgive me. I want to say it's the 26th, but whatever that Saturday and Sunday is.
Yeah.
It's going to be at Lurie High School. If you're interested in being a patient, generally the parking lot opens up midnight. So that Friday into Saturday at midnight, you can start waiting online. So to Dr. Switzer's point, really the only eligibility is you're willing to wait.
Mm-hmm.
So it's very safe and secure. The earlier you get there, it is first come first serve.
Right.
The more likely you are to receive the services.
Mm-hmm.
So just essentially just show up for your patient as
Yeah.
early as you can. We'll have some refreshments and things like that, but that's the first group. The second group, certainly we're looking for professionals and non-licensed professionals that are looking to volunteer their time.
Okay.
They can go to ramusa.org. They can select our clinic. So again, look for that last weekend in September of 2026. And there's a drop-down menu on how you can volunteer. So we have different shifts. Generally, we try to get people that are willing to be there all day.
Yeah.
But understand if you can only give 4 or 5 hours,
Yeah.
as long as you're willing to register. And then finally, the other group is folks that want to help out that may not be medical professionals but want to donate some money again. This is probably your best bang for your buck in terms of return on investment. So
Yes.
the easiest way, PO Box 45 or our website, pagefreeclinic.org.
Wonderful, wonderful, wonderful. And so on that note, I mean, as many of us are aware, there are drastic funding changes that are happening in the American healthcare system right now, whether that be with Medicaid or with other funding streams to rural hospitals or hospitals in general. I also know that the healthcare networks here locally have already, as a result, started to make cuts, inform their staff that cuts are coming, reduce hours and things like that. And so we're obviously looking at something that could have great implications on the quality of patient care, the services that they're able to be offered, et cetera, et cetera. So how do you see these things? Also, we have changes to medical insurance on a federal level, right? So subsidies for the market plans and things like that are going to be shifting and changing, and they make insurance unaffordable and or unavailable, otherwise unavailable to more adults. So you would end up with possibly, or we're projecting more uninsured adults. Is that correct?
It seems more likely than not that that's the way things are going to go. And speaking specifically of the the Medicaid population in that demographic that we primarily serve week to week
Right.
here in the free clinic, ages 19 to 64. It's always kind of hard to get your hands around the specifics as far as how many folks living in Page County would be affected by the cutbacks that we're discussing.
Right.
But I think it's a very conservative estimate that it could impact well over 1,000 people locally in that demographic. And thinking back to how we described our operations here, largely volunteer staff,
Mhm.
open 3 hours a week. Um, if we have a significant influx in uninsured patients, we are going to be challenged to manage that.
Right.
And it's going to be challenging in a number of ways. It's going to be challenging financially because as your volume goes up, your expenses go up.
Right.
It's going to be challenging from a personnel standpoint. So if there are folks listening to this podcast who have thought about volunteering their time somewhere, and that is whether you are a clinical person or a non-clinical person. I am trying to envision the scenario where someone would walk through our door and say, "Hey, I want to volunteer," and we would say, "Sorry, can't help you."
Right.
Somehow, I just can't see that scenario happening. So, whatever your interest or skills are, if you have been looking to contribute to the community with your time, we would be happy to talk with you about what opportunities would be here at the Page Free Clinic.
While these changes affect all healthcare systems in some way, shape, or form, I really do think that for rural medical clinics is going to be difficult for several reasons. I think that, um, and it's kind of heartbreaking in a way because if you look at the statistics, rural area medical clinics have some of the highest patient satisfaction scores in the country, and with usually the least amount of resources. So I wonder how those things might be affected by what's coming. And really, it's hard to get your arms around what the reality looks like until all those changes take place because we can project and do those things, and that's helpful. But until you see the volume of patients walking in the door, you really don't know. Do you see any other major challenges on the horizon for you? But at the same time, do you, or maybe you see vast opportunity for you?
So I mean, I think we just outlined the major challenge that I
Yep.
see. I mean, that's the one that keeps me up a little bit
Yeah.
at night. However, having said that, um, we one of the things about small rural clinics, free or otherwise, is you don't have a very deep bench when it
Mhm.
comes to your staff members.
Yes.
And so not to perseverate on this in the volunteer side of things, but if you have clinical or clerical skills that you can offer, one of the challenges that we are always facing is how fragile our staffing is.
Yeah.
And so that's probably the other one that I
Yeah.
would point out.
Yeah.
I always like to end the episodes this way. So I want to know, you guys do so much for the community. What can the community do for you? Is there one or two things that the community could do that could best help you in the coming year, right?
Absolutely.
What does that look like? I know donation, volunteering, things like that.
Spreading the word.
Spread the word.
Spread the word. We're here. We're open. We talked earlier. There's a couple thousand folks that probably qualify for our services that aren't using it.
Yeah.
Let's try to reach them. Phone a friend. Get
Mhm.
your care taken care of early.
Mhm.
So spread the word that we're here. Spread the word we're doing RAM. Spread the word that we're looking for volunteers and donations.
Perfect.
And if you're someone listening to this podcast or watching this podcast who is in need of these services, come here.
Please.
Yeah.
That helps us meet our mission.
Please, please, please. Yeah, I hope that this program and the stuff that we've talked about, one of the platforms that we push it out on is Facebook. And Facebook in this community and in many other communities in rural America is kind of the number one social media platform. So it's across the board, across demographics and socioeconomic classes, things like that. It's interesting, but it's the truth. So I am hoping that we can reach populations of folks who may be in need of these services. And like you said, absolutely. I hope that they will come and visit. Like you said, to remind folks, it's walk in. You can give us a call, right? You can give Free Clinic a call, ask any questions that you have. If you need, a reminder on what documents you might need to bring, etc. But please, please, I hope that they will come visit the Free Clinic. Just to cap this all off, thank you guys for everything that you do, and also thank the rest of the board members, the staff. As a person who was born and raised in this community and is very proud to be from this community, I I really appreciate all the work that you put in and the time and the management of the resources. All this stuff is not easy. And as you said, you both have other jobs that pay your bills. This is volunteer, and in addition to your everyday life. So thank you for cutting a trail, and for taking folks in need on that journey with you, treating them with respect, and helping them get access to the care that they need.